When you decide you'd like to change your appearance and you're interested in facial cosmetic surgery, you want the most, of course, qualified doctor to make the change for you. Dr. Robert Fante is a highly trained, warm, and caring physician who combines his expertise in surgery with an artistic sensibility and, of course, compassion. Trained in both facial and eye area surgery, Dr. Fante is a specialist in laser eyelid surgery, complex reconstruction around the eye, and also facial cosmetic surgery. Dr. Fante is back with us to show how you can experience his expertise for yourself when you're ready to choose the procedure, of course, that's right for you. Good morning.
Good morning. How are you?
I'm great. How are you?
Great, thank you.
And you know, patients, they always like to know the doctor's background and a little bit of what you've done. So explain that to us for our viewers.
Sure. I did my training in both the University of Michigan in Ann Arbor and in Boston, at Boston University, where I went to medical school. And I've been in Denver now for about 11 years after a stint in the Air Force, which gave me some great experience as well.
And a lot of people, you know, they're thinking your background in your office. What makes your office so special? And what do you want people to know about your office?
Well, we work really hard to make sure that everyone who comes in has an excellent experience, that they really have a lot of fun, that they have, of course, the best possible medical care that they can get. But we try to treat everyone with a lot of warmth and compassion and fun. I come from a big Italian family back east.
Oh,
and,
no.
Although none of my employees are Italian, we still have that experience of trying to make it a family affair.
A big family affair and very comfortable. What should someone look for in a facial plastic surgeon? There's a lot out there. What should they hone in on?
I think probably the two most important issues are a lot of experience with the particular thing that you're interested in having done, and probably also a highly specialized focus on the area that you're interested in. A lot of surgeons do a little bit of everything, started out in a specialty that's different perhaps than where they are now, or they do things on the entire body. And if you want to have, for example, your eyes done, I think it makes sense to go to someone who has background in both ophthalmology, as I do, as well as in plastic surgery, as I do, and really focus on those kinds of areas.
What are some other areas of services at your office?
Well, in addition to cosmetic surgery, we also do a variety of cosmetic skincare. I have several different estheticians who work with me and provide, again, a high level of expertise and empathy for people as they come in with their various issues.
And you really do specialize and focus in on the eyes, which are so important to a person's face. What truly sets you apart in that area? You briefly mentioned that because that is such a delicate area.
Well, there's a lot of issues that come up with people's eyes. Among them are issues of comfort, issues of safety, of course the ability to see, and of course appearance. And I'm very well versed in all of the different kinds of things that can go wrong, as well as the things that will make you look better. And so I focus on making sure that each person has a very individualized treatment program that involves making sure that they can see as well as have the comfort that they want, and of course have the best possible appearance.
Well, and it's also your eyes, that the qualifications that you have just for that area, they're so important. And before on the show, in the past, you brought on May Lee, and she had her own case about what she wanted done. What were her results, and what did she have done that you were so pleased with? Well,
she's actually doing very well. She had her surgery about 3.5 weeks ago, and has turned out great so far. She's very happy with the way that she looks and the way that she feels. Her eyes are very comfortable, and it's all turned out exactly in the way that we wanted it to.
What was her main? What was
well,
the part she didn't like?
She wanted her.
The part of her eye that she
was most concerned about the heaviness of her upper lids and perhaps an appearance that was maybe a little more Asian than she wanted it to be. She's obviously a beautiful girl, but she wanted a small change made.
Look at that.
And so these are photographs from 1 week after the surgery. You can see, and that's from 2 weeks after the surgery. You can see still she looks Asian and she looks like herself, but she looks a lot warmer, a little nicer, and she's more comfortable with it, she's happy with it, and they look a little less heavy, a little less tired, a little less severe.
Well, yeah, because if you look at her face, the eyes, the whole thing, her face opens up, she's brighter, her smile is brighter.
I think that's exactly true.
Yeah.
So I think it's been a good experience for her, as it fortunately is for almost everybody.
And the procedure, she had the procedure, and then just after a week, that was the difference that she saw.
That's right. These pictures that you can see right now are after 1 week. And that one's after 2.
And you say that she is so pleased with her outcome.
And she's very delighted. I think she's had a great experience, and it it's exactly what she wanted.
Now, a lot of people today with the tough economy, they have a limited budget and maybe they want to get some things done and feel better about the way they look. What would you suggest if one person had to really consider an area? Would it be the eyes?
I think the eyes are probably the place where you get the most bang for the buck. They're the place that people look at first when they're talking to you. They're the place where you look tired earliest in your life, so you have an opportunity to make a change soonest. You have an opportunity to have the thing that you put forth in the world first look as good as it possibly can, and it's relatively inexpensive for the kind of change you can make.
And we're looking at some more pictures here, and this is an older lady compared to Maylee, so a lot of different ages, and look at that difference.
She had a medical problem on her left side. You can see where the eyelid is actually so droopy she can barely see out of it, and so in her case that was actually covered by insurance. But you can certainly see a terrific difference in her ability to see as well as in her appearance.
Look at that one.
This is a woman who just was feeling very tired and wanted to look better. You can see there afterwards she does look less tired. She looks brighter. She looks like she's not so worn out with life.
Do you find that with most women and maybe even some men, I was just going to say it is around how you get puffy underneath and maybe a little lift to open up your face?
It can make a big difference. Many people have the experience, particularly men, have the experience of feeling like they're being passed over for promotions by younger folks, and because they look a little tired, they look a little worn out. This can make a big difference, make them look a little more alert, a little more bright-eyed, a little more on top of things, which they were anyway, but it just changes their appearance just that little bit to help them in the job.
Call Dr. Fontaine. He'll get you that job,
won't you? I am a very lucky guy because I got to go to great schools and got great training, and in addition to that, I'm able to have fun with the people who come in. We have a very comfortable atmosphere in my office, and I get to do good things for people.
You know, the one word you really used a lot today, and now I believe you, coming to a plastic surgeon, is the word fun.
It can be fun. Well, there's maybe a few moments that aren't so fun, but the rest of it can be fun.
Exactly. Now, does insurance sometimes cover most procedures? I heard you mention it for that lady.
They will cover droopy eyelids. Certainly as people get a bit older, typically you have to be into your 50s or 60s before that happens, although there are even children who sometimes have droopy eyelids where the surgery is covered by insurance.
You're doing wonderful work, and keep that word fun going in your practice.
We're happy to have it.
All right. You have a good day.
Thank you, Tanya.
Thank you, Doctor.